Here's a case of a 9 year old man.
Louder.
Here is a private case here. Just it's 9 years old man at UTH.
Are you just two?
Yes, right. So the doctor should say she went out. It's about out of the house. Okay. So the chief complaint was that the man has severe chest pain. And when diagnosed, he has a history of cardiac infarction, diabetes mellitus, and osteoarthritis on the knee. So we try to develop the contact plan for this patient. So now when we look at the drug therapy, we notice that one of the drugs we was PDP and also NSAID, drugs that diclofenac. And then the advice patient is not to take the diclofenac, but it's going to increase the MI, contribute to the MI. And also we look at the problem related therapy, like the therapy related problems, like I mentioned, the PDP is going to cause an increase in the cardiac infarction because this PDP is going to cause an increase in vasodilation, which will increase the blood pressure, and this also in turn increase the heart rate. So it was ruled out.
That is what we do that.
In PDP, it is going to cause increase in vasodilation. So we now bring down the blood pressure. So it was ruled out. So it was going to cause an increase in the heart rate for the man who has AMP already. And then the other drug, like Lufena, it is going to cause an increase in water and sodium retention, which will increase the blood pressure. So that was the items. So since this man was a chain smoker, he smoked for 40 sticks a day. So the man was asked, is this from smoking? Because smoking is risk factors for cardiac infarction. So now the person was giving to us, he was asked to explain the kind of action of the drug called Redeflex, which is used to cure cardiac infarction.
Okay, so reticulins, antibiotics, they are plasminogen activators. Essentially, reticulase is a thrombolytic, and thrombolytics they are plasminogen activators. So they convert plasminogen to plasmin. So in myocardial infarction, we know what myocardial infarction is when there's an occlusion of the coronary artery leading to disruption of blood flow and oxygen, causing ischemia and necrosis. So reticulase it binds to plasminogen, catalyzing its conversion to plasmin. So plasmin is what is responsible for breaking down the fibrin mesh of blood clots, what is blocking the blood vessels. So it breaks down the thrombus, the clots, disintegrating it, essentially dissolving it. So by this mechanism, it now restores blood flow and oxygen to the ischemic myocardium.
So what's the side effect when taking it?
Of the Philippines.
No. What do you call it? What did you call that drug?
Retinase.
What's the side effect? What's the prominent side effect?
Okay. I didn't really read. I didn't read more into it.
You didn't read what?
I didn't go in depth.
So I don't understand the Redeflex. I think I found two forms, the itself and then the Artiflex. So the difference between these two drugs is that they have one has shorter half-life, one has a longer half-life. So the one with the shorter half-life now, the one with the shorter half-life, it is not going to give effective the therapeutic effects. Why the one with longer half-life now will ensure that the clot is properly dissolved and is given as a bonus administration IV. 10 minutes IV in 30 minutes and 30 minutes gap or difference.
The side effect of that drug. What does the drug do? It does what? It prevents what?
It breaks down the fibrin mesh, so it will dissolve the blood clots.
So what will be the side effect?
It does not allow blood clots to form, so that means
Now, you are talking, and the thing is there before you. So what's the side effect? You now said you start. What were you saying, sir, this man? Eh? What were you saying? Was it side effect you are talking about? That thing you are talking.
Okay, actually, science effect and possibility. So looking at that there are two
So, eh, what's the general name for those kind of drugs that prevent clotting? And you call them what?
antiplatelets also.
Anti,
Antiplatelets.
anticoagulants. Abi?
Anticoagulant.
So, did you read anything about anticoagulant monitoring? How do you monitor the patient
Depending
on those kind of drugs?
if the patient is bleeding, discontinue the drug.
Let them hear you.
If the patient is bleeding, you discontinue the drug, not the drug.
If the person is bleeding,
If the patient bleeds on the course of taking that drug,
uh,
you discontinue the drug administration.
okay, in in a clinical an intensive unit, you go into an intensive unit, you look at the patient there, from your own, as a pharmacist, your own knowledge, describe a patient you think should be on an anticoagulant. What would be your impression? You just go into, an intensive care unit, ICU.
Yes.
You go in there and you look around, look at the patient. Which one will you actually say will need an anticoagulant ordinarily, and why? You understand what I'm saying?
Yes, sir.
Okay.
When I get into the IC unit, I will look at the patient's folder to check what has been recorded for the patient. And if it's noticed that that patient, has been having of mechanical infarction or there is blood blockage of blood flow in the coronary artery, or this patient needs anticoagulant to break down the
So every MI
blood
patient
clots.
needs antioxidant.
So
Every patient of every patient with myocardial infarction needs
if it's
antioxidant.
caused by blockage of blood flow, maybe there's a blood clot in the arteries.
Uh, Siphon,
So what antioxidant will you give the patient?
Like this.
Okay.
what was your own contribution now that you are here? Louder. Do you have any contribution? You don't want to make your own contribution. Are you part of the team? So you didn't read. So what did you? Let us hear what you did. What are you saying? Louder. Are they hearing you behind?
Receptors has a faster onset of action and a longer half-life compared to other tissues plasminogen activators, making it suitable for emergency situations.
Finish.
Then the mechanism of action of receptors is that it acts as a catalyst, converting the inactive plasminogen protein into its active form, plasmin. And then the plasmin then breaks down the fibrin network that forms the structural core of the
You have tried. At least you have said something.